Some prescription cough medicines contain ingredients that are said to be mind-altering substances. This means that if taken in high doses, cough medicine can cause similar effects on the mind to alcohol and marijuana. Two common ingredients found in cough medicine are dextromethorphan, that is a cough suppressant, and codeine, which is a naturally occurring form of morphine that reduces feelings of physical pain. These substances taken in small doses have mild effects on the brain that are virtually unharmful in the long term and only slightly noticeable in the short term. For example, an individual might feel a slight lack of energy after taking a recommended amount of prescribed cough medicine. They will not continue to experience these symptoms after it wears off and they stop taking the medicine. If these substances are taken in high doses by consuming more cough medicine than the prescribed amount, the effects on the brain are harmful to an individual's personal health in both short-term and long-term and are quite noticeable to the individual and those around them. Individuals may experience an extreme feeling of lack of energy, which may or may not wear off after the effects of the medicine subside and they are no longer taking the prescription. Individuals may feel agitated, have poor motor skills, slurred speech, blurry or distorted vision, a headache or stomachache, experience extreme drowsiness while under the influence of these substances in high doses. All these effects pose major threats to personal safety and the safety of others. Cough medicine can be purchased legally over the counter in drugstores without a prescription. Therefore, it is a popular drug used and abused by individuals. It is often mixed with other substances, such as alcohol when consumed. Mixing substances only adds to the health and safety risks, because this increases the level of intensity of the drug and the effect it can have on the brain. Cough medicine, like other drugs taken in high doses, causes the brain to release dopamine to the brain's reward pathway. If an individual continues to abuse the substance, their body will start to crave the dopamine that their brain administers while intoxicated. This can lead to the long-term effect of addiction. Individuals will become dependent on cough medicine to feel the rush of dopamine because their body will no longer naturally administer it to the brain. So in short, it's not fun to be on cough medicine, and it certainly is not fun to be dependent on cough medicine. Think before you drink.